You got pain in your knee? This is Dr. P, otherwise known as Dr. Mark Petropoli. I am a strong believer in giving it biologic help to heal. What do I mean by that? Well, there are certain things that can be done to help ligaments heal faster and better. And one of them is completely non-invasive. There's no needles, no shots, no known side effects. It's very, very safe. It's called MLS laser therapy, and MLS stands for multi-wave lock system. It's the type of laser we use, but it's a very powerful healing laser, and it has two different wavelengths of light, hence multi-wavelength. And so they work together to help the body heal itself. I have other talks on laser, so I'm not going to get into all the details, but basically it stimulates the mitochondria, the little powerhouse of the cell, which helps with healing, increases blood flow, which helps with healing, decreases swelling and inflammation, which helps with healing, and then it also has a direct pain relieving effect. So that's how the laser can help. And the cool thing about that is there's no needles, no shots, completely non-invasive. There's no pain involved. It's just a treatment where the laser is about 8 inches away from the body, and it helps with healing. So that's one thing. Another thing that we'll sometimes try is PRP, platelet-rich plasma, or bone marrow aspirate cells. PRP is where we take some of your blood, spin it down, and get the platelets out. The platelets are those things that when you cut yourself, they form a scab and they stop the bleeding, but they also have growth factors, and they release those growth factors, and those growth factors stimulate new blood vessels and cells to come in the area. So we are able to take your blood, spin it down, get a concentrated amount of platelets, which think of that as almost like a fertilizer pellet, and then that does require using an ultrasound, which is a sound, it's kind of like a sonar device, like a boat or a fish finder, but we use it to look inside the knee joint and place a needle in there. We do numb it up, we place a needle in there, and we inject the platelets or the growth factors right next to or into the ligament to try to stimulate that ligament to heal better and faster. And I've had some remarkable results of people who we got an MRI on after an ACL tear, and then we just followed them along without doing anything, versus laser versus PRP. And the vast majority of the time, the laser and or the PRP help that heal faster. Sometimes we'll even go even to the next level. If it's even more of a tear, maybe it's not torn all the way off the bone, but it's almost torn off the bone, the thigh bone, and we will take bone marrow cells. So bone marrow has stem cells and other cells that help the stem cells. Stem cells can turn into other tissues, and they can also tell other tissues what to do. And again, I have more videos on specifically talking about stem cells, and you can watch those. I'm not going to get into all that, but basically what they do is they help with healing, and the cells are what do the work. So when it's a more severe tear, and or some people just don't want surgery no matter what. So if you're like, I don't want surgery no matter what, then I would go with the bone marrow cells, because that's the highest level of healing that we can give to somebody biologically. And that's a procedure that's done in the office. It's not a surgery. Numb up the skin a little bit, take some bone marrow cells from the pelvis, not the hip, not the spine. It's an area on the back side of the pelvis. It's right underneath the skin. We're able to take the cells, and then the same thing, using ultrasound. You got to be good at it. Don't let someone do this if they're not using an ultrasound, but you got to use the ultrasound to look in there and inject those cells exactly where you want them. Some people will use fluoroscopy as well, which is actually a live x-ray, and that does work very well as well, but that does require radiation, whereas ultrasound is sound waves, and that's pretty much harmless to the body. If you want to know more about this or you have questions, go to the comments section, subscribe to our channel, and if you like that, please like us.